Chapter 7: The Nursing Process and Standards of Care. Every nursing student's favorite nursing organization, Ch7, Quality and Safety Education in Nursing. This is an organization that sets standards in areas of focus to improve patient care. Many of these standards include things like patient-centered care, interdisciplinary teamwork, the use of evidence-based practice, application of quality improvement, and the use of informatics. Another source for standards of practice for nursing would be the official ANA publication. In this case, the Psychiatric Mental Health Nursing Scope of Standards and Practice would be the American Nurses Association's publication directly for mental health. And the basis for certification criteria, the legal definition of psychiatric mental health nursing, and the National Council for State Boards of Nursing Licensure Examination, and collects questions. Among these Ch7 competencies, you're most commonly seen are going to be providing patient-centered care. And by this, they mean that patient is the central focus of that care. They get to make informed decisions about their care, and they receive care based on where they prioritize, what they feel is the best course of action. Other ones working in multidisciplinary teams, it's not just doctors, it's not just nurses providing that care. There's everything from respiratory techs, social workers, pharmacists. There are a lot of multidisciplinary team members and different people helping to care for that patient that all need to work collaboratively. Other ones employing evidence-based practice, that's been a big push for a long time. We're constantly using the best, most up-to-date research to improve patient care. Also, implying quality improvement. We're constantly improving. We're constantly striving to better the services we provide. And finally, utilizing informatics. Monitoring those statistics. There's a whole nursing informatics, nursing statistics is its own unique specialty, and a very interesting one if that's something that you're interested in. I'd say about every major hospital has their own informatics and risk avoidance department if that's something that you're interested in. Other standards of practice, one that's never going to go away is the importance of that assessment. We're going to do that thorough, head to toe. We're going to collect as much data as possible. Then we're going to analyze and synthesize that data into what's pertinent and what could be most helpful in the treatment of this patient. A major focus on HIPAA guidelines, that's a federal law that is across the country of just mandating, when you see HIPAA, immediately be thinking privacy. There was a lot of things involved in that law, but when you see HIPAA, immediately be thinking patient privacy. Other standards of practice, age considerations. Children, we need to be consulting their caregivers. Can a child consent to treatments? No, it has to be from their parents. The secondary sources, the patient is that primary source. And use the interview, observations in play. Observe that patient, both what they say, but especially in children, observe their body language. For adolescents, explain the need to share some information with other adults. Risk factors are going to be a priority. We all know teenagers can take risky behaviors. They're not necessarily thinking long term. They're not necessarily thinking into the future. On the other end of that, it's older adults. Avoid dismissive stereotyping. Identify and accommodate for any disabilities, any sensory impairments, and do what we can to make sure we've made that patient as comfortable as possible. Identified, again, any signs of abuse for both the children and elder. Other considerations, interpreter, translator. I tell you right now, if you're sitting on NCLEX, ATI, and there is any hint of a language barrier, the answer is getting an interpreter. Getting that interpreter phone, getting an interpreter right there at the bedside. Can it be a family member? That is like a last resort. They are not certified medical interpreters. And for NCLEX, for ATI, you have every resource available to you on the planet. And you need an interpreter, there is a certified medical interpreter that will be right there for NCLEX. And yeah, if you have any hint of a language barrier, the answer is going to be an interpreter. Our first case study. A patient in the early stages of Alzheimer's has not been doing well. He's still aware of family members, including his sister who's moved in with him. She says, I still have to work, so the neighbor downstairs checks in on him during the day. And there's a bell, so he knows if Eggers tries to leave by himself. Mr. R's sister has brought him into the clinic because she's worried about some recent weight loss and some progression of the disease. What concerns, if any, do you have regarding Mr. R? Are there any safety concerns? If so, what are they? And that's your first thought right there. Is Mr. Edgar safe to be left home alone? Yes, they say the neighbor looks in on him and he can ring a bell. But is he safe enough to be at home alone with that level of Alzheimer's? You'd really have to have more information, a better assessment, speak with Mr. R before you can make that kind of judgment. But at the same time, yeah, your first thing that should be going off is safety. Other concerns is definitely going to be that weight loss. That's a major concern with the all elderly, especially with Alzheimer's and confusion. Is he able to feed himself at home while she's not there? Is he able to cook? Is he able to clean himself? A lot of different safety and basic physiologic needs have question marks from just what we got from that first part of that case study. The psychiatric mental health nursing assessment. Just like every other assessment, that focuses on gathering data, review of systems, reviewing lab data. That's going to be a big indicator if somebody's suddenly confused. Think about things like high blood sugar, low blood sugar, and like potassium, a lot of different electrolytes, salt can cause confusion and neurologic deficiencies, neurologic disturbances. That's going to be a big clue. We want to make sure we're always checking the labs on these, but we're also conducting a thorough psychiatric evaluation as well. For this, we actually have a mnemonic, aseptic, used to remember the components. And that's going to be A, appearance and behavior, S for speech, E for emotion, mood, affect, P for perception, auditory and visual hallucinations, T for thought content, I for insight and judgment, and C for cognition. Here we have a link for a video, along with a form where you can actually fill out the mental status exam form to evaluate the client within the video. And I'm going to post this down below in the Open LMS, and when we pull that up after we finish up here, you can complete it yourselves. There's going to be some unique goals as far as a psychiatric mental health nursing assessment goes. And first is establishing that rapport. These patients can be very nervous, very anxious, very guarded, even embarrassed about what's going on. And doing what you can to set that client at ease and get them talking, have them feel comfortable opening up to you. Other things, understanding the current problem, reviewing physical baseline status, identifying risk factors, assessing psychosocial status, and establishing mutual treatment goals. What is a priority to you may be a different priority for that patient. From there, you can formulate that plan of care and always make sure you're documenting that data very thoroughly for any psychiatric situation. Other major considerations while gathering that data is going to be everything from spiritual and religious assessment, cultural and social considerations, validating that assessment, and using rating scales so you can try to objectively measure some of these subjective findings. Moving on with our case study, as you begin the assessment process, Mr. R stops you and says, "I don't know why you need to do an assessment. I'm just here to get my medicines adjusted." How would you respond to this guy? What is the purpose of a psychiatric mental health nursing assessment? And we are really going to be assessing our entire patient. Is he actually think that he's there to get his medications adjusted? What was his chief complaint? How did he find his way into the clinic? It sounds like his sister was concerned and brought him in for an evaluation, and he's a little bit disoriented and confused of why he's here. Or maybe that could also be the excuse that the sister gave him to get him to come in. We really need to make sure we're getting this patient comfortable, we're talking to this patient, and getting a good baseline. For our first audience response question, which term on an assessment form is broader? What is the broadest term on there? Would that be spirituality, religion, or church, mosque, temple, synagogue? And that answer is going to be A, spirituality, because spirituality could extend beyond many different religions, many different philosophical ways of thinking. You discover that part of Mr. R's lack of appetite has been due to a urinary tract infection he has been unable to articulate. You ask his sister for more information about the home environment, activities of daily living, and medications. What type of information source is his sister? Is she a primary, secondary, private, or informed? And she's going to be a B, secondary source. And these are valuable. She lives with the patient. She knows his day-to-day routine. She's going to know a lot about this patient. For a normal, healthy, functioning adult, yeah, you're going to want to go to that patient, that primary source. But in this case, with the Alzheimer's disease, it seems like we got some confusion going on. Having a sister involved, helping to corroborate and answer some of these questions, would go a long way in helping you to get an accurate picture. Standard 2, diagnosis. We're going to analyze the assessment data to determine any diagnoses, potential problems, and areas of care and focus, including that level of risk. Is this patient in danger? Are they a danger to themselves? Are they a danger to others? Being left home alone, it's not like the sister's abandoning him. She has to go to work. She can't watch him 24 hours a day. But a major focus for us is going to be, is he safe to being alone at home? We want to identify any potential problems, any causes, and gather as much supporting data, signs, symptoms, and evidence of the current situation. Two types of nursing diagnoses. One's going to be a problem-focused diagnosis. We're going to be looking at a current issue this patient has. Another type would be a risk diagnosis, and these are what the patient is at risk for. If a patient's on metoprolol, they're at risk for bradycardia. Patients taking insulin, they're at risk for hypoglycemia. Patients taking an SSRI, they're at risk for serotonin syndrome. And when you're doing care plans, you always want to make sure you've got a mixture of these two. You've got some problem focus. What problems is currently, what chief complaints and problems are going on with this patient, but also include some risks of what could be dangerous down the road for them as well. Standard 3, outcomes identification. Outcome criteria identify expected outcomes that reflect the maximum level of patient health that can be realistically achieved through planned nursing interventions. Can we make every single patient 100% healthy? No. But can we definitely improve the quality of life for our patients? Absolutely. And the principles, we need to reflect on measurable desired change. When we set goals, we want to have a objective measurement of have we achieved that goal. Provide direction for that continuity of care. We're not just throwing them off to the next provider. And we always want to write these in positive terms. We want to make sure we've written these objectively, and we want to make sure we've written them clearly and make them realistic as well. And planning. We're going to prescribe strategies to assist our patient in attaining these goals, meeting these outcomes that we're hoping for this patient. And these can be everything from evidence-based interventions and treatments. This is going to be that gold standard. For nurses, it's a combination of clinical skill and using that relevant research to deliver effective patient care. Using that best available resource, incorporating patient preferences, and making that sound clinical judgment. And the principles to consider when planning: safe, compatible, appropriate, realistic, individualized, and evidence-based. For registered nurses, we're going to have a lot of responsibilities and interventions. One's going to be that coordination of care, maintaining every aspect of that, and also maintaining that milieu. Remember we talked last week, my favorite term, milieu. And when you hear milieu and milieu therapy, we're just talking environment, and maintaining a therapeutic environment, relaxing, a place where the patient can open up and not be on edge. Also things like health teaching, health promotion, pharmacologic, biologic, and integrative therapies. And I can't stress enough that milieu therapy. Standard 5, implementation, therapeutic relationship and counseling. It's going to come up a lot throughout mental health about the importance of establishing that rapport with the patient. It's part of the therapeutic milieu. Is you want that patient comfortable. You want them to open up. You want them to tell you about their problems. And they're not going to do that with on edge. They're not going to tell you about these sensitive issues if they're not comfortable with you, if you have not established a rapport. Providing presence and a sounding board. Just active listening to their problems can go a long way in helping some of these patients. Other things, reinforcing healthy behaviors, helping the patient to recognize maladaptive behaviors, and helping the patient identify positive coping strategies. Other parts of Standard 5 and implementation is going to be those advanced practice interventions. And if you're looking to continue on with your nursing career and interested in mental health, psychiatric nurse practitioner is still one of those in-demand and well-paid NP specialties. There's some NP specialties that are very oversaturated. It can be difficult to get that first job. Psych NP is not one of them. You'll hear of a lot of them getting hired before they even graduate. And part of their role involves everything from consultation. This is an advanced practice role that involves assisting other registered nurses and members of the interprofessional team in addressing those complex issues and situations. Evaluating that evidence-based information, the clinical data, and providing that framework for the patient's entire course of treatment. Other aspects would be prescribing. This is accomplished through that, again, evidence-based treatment, identifying which medications would work best for that patient. And in the case of these psychiatric medications, you're also often going to see a lot of adjustment needed in the levels to get that very therapeutic effect. And finally, the key part of any intervention is going to be that ending evaluation. We're not just providing treatments to the patient and going on our way. You always want to evaluate the effectiveness. Even if it's something as mundane as Tylenol, we still want to come back and evaluate how effective that was to guide our future treatments. And this evaluation must be systemic, ongoing, and criteria-based. The cornerstone of any area of nursing, and especially mental health, is going to be documentation. Remember, this is a legal document. Always be writing your documentation as if you're going to be reading it in court, because there are a lot of lawyers out there. And again, always be objective, just the facts. We want to tell an accurate and objective patient picture. We want to be detailed. We want to stick to just objective measurements wherever possible. Include that patient condition, informed consents, drug reactions, patient concerns, adverse incidents, any issue that went on throughout that day. Remember, if you didn't document it, it was not done. And finishing up with our case study, as Mr. R's sister has suspected, Mr. S sometimes forgets to eat. In which part of the nursing care plan would the nurse expect to find this statement? Offer snacks and finger foods frequently. Would that be assessment, diagnosis, planning and outcomes identification, implementation, or evaluation? And again, that is implementation. We are prescribing a treatment. We are giving a recommendation. In that case, it's offering snacks and finger foods. You also see examples like soup in a mug, making sure you've turned off the TV so if that patient is focused only on eating and not getting distracted. And also those Boost supplement shakes. And our last slide of this chapter. You teach Mr. R's sister about important precautions associated with a new prescription. Afterward, she accurately summarizes major self-management strategies associated with this drug. Which step of the nursing process applies to her summarization? Would that be A, assessment, B, analysis, C, planning and outcome identification, D, intervention, or E, evaluation? That's going to be E, evaluation. Anyway, and that's all we got here for this chapter. I'll see you in the next slide deck.